Well, thank you all for joining us for this webinar this evening with Women for a Healthy Environment. I'm going to do a quick introduction and then we are going to jump right into the session. So I'd like to introduce our speakers. We have Sam Hernandez, Masters of Public Health, who is our Healthy Learning Programs Manager. And we have Piccola Abely, who is also a Masters of Public Health, who is our Director of Healthy Learning here at Women for a Healthy Environment. So I'm going to turn it over to them.
Thank you, Paige, for that introduction. And I'll jump in with an overview of our organization, Women for a Healthy Environment. Women for a Healthy Environment is a nonprofit organization that empowers underserved communities to build resilience, promote equity, and safeguard children from environmental health hazards. We collaborate with families, schools, and early learning centers to create healthy environments where children can flourish. Guided by science, we advocate for policies and programs that foster equitable lives free from environmental harms. In our Pittsburgh office, we have three main program areas: healthy homes, healthy schools, healthy early learning, along with health policy. And in our Philadelphia office, their efforts are focused on early learning. So in this module, we are going to identify 3 sources of lead exposure. We will identify 3 health effects of lead exposure in children, and we will also identify 3 actions to reduce or eliminate lead exposure. So you may have heard of lead poisoning before today, but you may not know much about it. Our goal today is for you to walk away with an understanding of lead. We will learn what lead is, where lead is found, how lead can harm both children and adults, and potential impacts on the environmental, wildlife, and cultural practices. Please keep in mind that lead exposure and lead poisoning are preventable. We can take actions to reduce potential exposures to lead, and there are laws in place to protect us. At the end of this session, we will discuss several actions we can take as a community and as individuals to reduce potential lead exposure. Before we begin, I have a few questions for the group to gain a better understanding of what you already know about lead and lead poisoning. So I'm going to ask a couple questions, and I encourage you all to answer in the chat. So first question, how many of you have heard of lead or lead poisoning before today? Feel free to also raise your hand for this question.
So we have some people saying I have from Velda. A few have said I have, yes.
Okay, great. Now, what are some things you have heard about lead or lead poisoning?
We have in the chat, it affects the brain.
Okay, yes, we will be talking about that briefly. And third question, does anyone know either what year their house or school building was built, and if it was built before or after 1978? And for those of you who have or work in a building that was built before 1978, this session is going to provide you with information about lead-based paint that may be in your school or early learning center. And I'll just move forward from here. So I encourage you all to scan this QR code. This is a pretest so we can get an understanding of your level of lead awareness. So I'll just pause here and give folks maybe a few minutes to complete this.
And Sam, if you don't mind, and if you're on your phone, you can just simply type in that website, the forms website.
Thank you, Paige, for mentioning that.
Maybe we could put it in the chat. Let me try to get it for them.
And then we have Tamika has her hand raised. Yes, Tamika, you can, if you have a question, you can unmute and ask. So you won't be able to scan it while you're on your phone. We are working on getting the website, the URL into the chat. So you're able, yep, Pacola just got it in. So you're able, she sent it to the hosts. So you'll be able to click it and go from there. Tamika, did you have a question with your hand raised? Maybe it was an accidental hand raise. Yeah, you can also answer them on another phone, however you are able to. Oh, thank you for letting us know. However you are able to get to the pretest um, works for us. I'm gonna. Perfect. We do appreciate you guys letting us know when you are done. That is very helpful.
There we have 11 people who have completed it, so there's just 2 people that haven't done it yet. Good. All right, I think we are good to go.
Great. Okay, so in the chat, let's make a list of questions you have about lead and the health impacts of being exposed to lead, with the hope that by the end of this presentation, we will have covered and answered all of your questions. And if you don't have any questions right now, you're more than welcome to come up and add your questions later. I'm gonna move on to the next slide, but if you want to just keep these questions coming and we can address them at the end of the presentation. I would like to acknowledge that the information we're covering today may seem alarming, but when we become aware of and educated on the subject, we are empowered to take preventative action to safeguard our health. Preventing lead exposure in young children under 6 years old is especially important because as their bodies grow and develop, they are more vulnerable to the permanent impacts of lead. As school personnel and early learning providers who care about our community well-being, we can take simple actions right now to prevent lead exposure, which at the same time can benefit the overall health of our land and the children we care for. Exposure to lead is preventable. So when it comes to actions to reducing potential lead exposure, the first thing we have here around the circle is cleaning your early learning center, but this could also be school classroom, once a week using a clean, wet, or damp cloth, sponge, or mop to minimize dust, which may contain lead. Second, it's important to eat a well-balanced diet with foods high in calcium, iron, and vitamin C to help reduce the absorption of lead. Three, so using soap and water to wash children's hands several times a day, especially after playing outside or with animals. Playing in grass and dirt not contaminated with lead, and using designated picnic, camping, and hiking areas. Hiring a certified lead professional when doing renovation, repair, or painting, which could disturb painted surfaces in an early learning center or school built before 1978. It's important to keep children out of the work area when lead work is being completed. Okay, also changing clothes or wiping shoes and showering to avoid tracking lead into a classroom, school, or early learning center. That may be from soil, work sites, or hobbies. Washing daily any items that your child uses regularly, such as pacifiers and toys, to minimize exposure to lead, which may contain lead. Lastly, using effective filtration systems to ensure safer drinking water. So what is lead? Lead is a naturally occurring bluish-gray metal found in small amounts in the Earth's crust. Lead is mined and then used in products to make them durable and last longer. Once lead is used in a product, it is nearly impossible to identify with the naked eye. Lead does not biodegrade or disappear from the environment over time. Okay, so we'll take a moment to reflect here. Where is lead found and how is it used? And I could just explain here. Lead has been mined and used for a long time and can be found in many different products and places. And what everyday products do you use that you think lead can be found in? So I'll repeat that again. If you want to answer in the chat, what are some everyday products you use that you think lead can be found in?
We have some answers coming through the chat. We had someone say battery, dishes, cleaning products.
Okay, those are all great responses. And I want to reassure that several laws have been passed related to lead. These laws address lead in paint, dust, and soil, also lead in the air, lead in water, and disposal of lead waste. As a result, these laws limit the amount of lead that can be found in products, outdoor air, emissions from some industrial sources, wastewaters, and more. In Pittsburgh, the lead safety law is a new policy that went into effect in November 2021. The law requires childcare facilities built in before 1978 to have inspections for lead in paint, dust, and soil. This is done through a lead dust wipe and a visual assessment of paint and soil. If lead exposure is found in a facility, it must be remediated and get re-inspected. Facilities that pass an inspection must get re-inspected every 5 years. Facilities that don't pass inspection must get re-inspected every 3 years. Additionally, any plans for demolition, renovation, and repairs must consider lead safety, and water filters are highly encouraged in early learning environments. In Philadelphia, childcare centers in buildings built before 1978 must have a lead safe or lead-free certification. The building owner is responsible for coordinating the lead testing and renovation. A visual assessment of soil and paint surfaces will be conducted in addition to a dust wipe and XRF testing. That's using like an X-ray device that detects lead in surfaces like walls. It is if a lead exposure is found, the facility must remediate and get re-inspected. After submitting inspection and renovation results to the city, lead safe certificates must be completed every 4 years, and lead free certificates do not expire. Unfortunately, lead can be found in all parts of our environment. That includes the air, the soil, water, and inside learning facilities. Much of our exposure comes from human activities, including the use of fossil fuels, past use of leaded gasoline, some types of industrial facilities like mining and manufacturing, leaded fuel, and the use of lead-based paint in buildings. Historically, lead compounds were added to paints to enhance color, reduce corrosion, or shorten drying time. Lead-based paint, if present in older buildings built before 1978, may be a major source of exposure to lead to those who spend large amounts of time in that space. When painted surfaces are not properly maintained, paint can deteriorate, pill, chip, or crack. When lead-based paint is old and worn or is subject to constant rubbing, such as in the case of doors and windowsills that are high friction surfaces, lead-based paint chips and dust can scatter and become a hazard. These hazards can be breathed in or swallowed by children and staff who work in these learning environments. Lead dust can also be scattered when paint is disturbed during renovation, repair, or modeling. More than 80% of homes in Allegheny County were built before 1978, which is the year when lead was removed from paint. More than 40% of homes were built before 1950, when lead paint was used most frequently. In some neighborhoods of Pittsburgh, over 10% of children tested positive for elevated blood lead levels. From 2009 to 2017, the percentage of children who tested positive for elevated blood lead levels had consistently been higher than the average for Allegheny County. And in Allegheny County, all children are required to be tested for lead exposure between 9 and 12 months. In Philadelphia, similar to Allegheny County, more than 80% of homes were built before 1978 when lead paint was banned. More than 50% of homes were built before 1950, compared to that 40% of homes in Allegheny County. Up to 10% of Philadelphia's children have elevated blood lead levels. And according to new research, the highest risk areas for lead exposure are North and West Philadelphia, and studies show that low-income children and children of color living in urban areas have the greatest exposure to lead. There is a clear link between elevated blood lead levels and demographic factors like household income and race. Buildings that have lead-based paint increase the opportunity for children to be exposed to lead. We are aware that children put toys, fingers, and other objects in their mouth as part of their normal behavior. The chips and dust can create an unsafe environment for children to explore. Lead-based paint also has a sweet taste, which can make it appealing to young children, so they may lick or buy chewable lead-based surfaces. Lead and lead compounds have been used in a wide variety of products in and around learning facilities, including paint used on imported pottery, scented candles, glassware, toys, ceramicware, batteries, ammunition, old cell phones that are in disrepair, and cosmetics, like lipstick. Lead is a neurotoxin that is harmful to humans. There's no safe level of lead exposure. Lead poisoning creates permanent cognitive and behavioral damage. There are no effective treatments for lead poisoning. It's particularly harmful in children under the age of 6, as the brain and nervous system are still developing, and cumulative negative effects can be seen in adults as well. Lead pipes are more likely to be found in older cities and buildings built before 1986. You may be wondering if it is safe to take a bath or shower using water suspected of containing lead. The answer is yes. Bathing and showering can be safe for you and your children, even if the water contains lead. Human skin does not absorb lead in water. Unfortunately, lead can remain in the environment for many years and enter soil and water. Lead in soil can settle or be absorbed by plants grown for fruits or vegetables, or plants used as ingredients in food. Some plants that grow in soils with a high lead concentration can absorb lead from the soil, with most of the lead remaining in the roots, and in some rare cases, even make its way to the above ground parts of the plant. Lead can also be found on the outside surface of plants, either sticking to the roots or by settling on the leaves and stems when lead dust is spread through the air. For example, lead in soil can be ingested due to hand-to-mouth activity that is common for young children, and from eating vegetables that may have taken up lead from soil in the garden or field. Lead in soil may also be tracked into a house on the bottom of the shoes. Okay, and with that, I'm going to pass it to Bicola to continue this presentation.
Thank you, Sam. Thank you so much for giving us that great information about lead. So I'm wondering if anybody has any specific stories of how lead has impacted their community specifically. An example could include maybe there's an abandoned mine that was like leaking into your water supply or anything like that. If you prefer to speak, you can raise your hand and we can allow you to talk, or you can just type it in the chat. If there are no responses, then Sam, if you could go to the next slide, then we could show a video of how lead has impacted someone with a personal story. This was someone that we interviewed with our Life Without Lead Summit that we held, Women for a Healthy Environment, held last year. So I will just mute myself.
Your story, Maury?
Huh?
You gonna tell your story?
Yeah. I read like dinosaurs. Like good dinosaurs. Like that, like red.
My daughter got really, really sick, and they didn't know what it was or what caused her to get like that. I thought she was having like a stroke or a seizure, and she was in the hospital for about a week, ICU. And when I took her to her follow-up, when she got out the hospital, he was due for a 2-year checkup, and then his levels were like extremely high. So then I took him to get an intravenous test, and it was still high. And then that's just where everything. I contacted the health department and explained to them that he tested positive, and they tested my home, and it was just lead was everywhere. 13.7 when we started,
And this is for your daughter? Or?
This is for him.
Okay.
They said she had lead in her system, but it wasn't dangerously high, so I don't know what that means.
Okay.
I still don't know what happened to her, like what got her to that point. But it was like 13.7 or 14.3 or something like that. Then when they did the intravenous, it was like half of that.
Okay.
So it was still like extremely high. His teeth and everything got soft and broke off. Top 4 teeth got like replaced because the enamel was so soft from the lead that his teeth was just like weak. So he's in DART and all the programs that just track his developmental and so far. And of course, you can see he talks like a. So they don't have any like major concerns, but I don't know if that'll affect them in the future. But he seems to be okay. Once they got diagnosed, I contacted the health department and I explained to them, and they came out and did like a surface check, like for like chip paint or anything. And then they took cultures and they sent them out. And once they got the numbers back, they contacted me. And then I contacted my landlord, and he had like I think 30 days to do repairs, because there was like some things that were in red and some were in yellow. So the red things needed to be fixed immediately. And he was supposed to fix them with us out the house, which he refused. So then you guys got me a hotel for like a month, and he still didn't fix it. So then they stopped paying him, and eventually he might have just got done fixing it in August. On top of like the lead, he like I guess it was just too much for him, so he decided to tell me he was selling his house. So I actually have a pending eviction, which is keeping me at a moment from moving forward, because everybody would see that and be like, well, what's the story behind this eviction? And then when they would call him, he wouldn't answer. So once we used our time up at the hotel, we ended up back at the house, and he did end up fixing things while we were home, which made it dangerous. But
him.
So how did it affect you
Her back
as a
and
mom?
her eye. And
Terrifying.
Her eye.
like guilt, like should I still be in this house? Where do I go? Like, you know, you guys provided me with a vacuum and mops and rags and different cleaning solutions, but
Dark green.
I'm still like a mess because I'm still in the house, unfortunately. I don't know if they maybe should try to come up with like a plan for people who go through this, where they have somewhere to go that is safe. But there's so many gray areas that a lot of people don't know what to do. Like I have a friend, she just called this morning. Her daughter just got tested positive for lead. So she instantly called me, and I told her I would refer her to you guys. But it's just like, I can't even, I mean, I'm not one to like diagnose myself or like bring things on, but I will say like stress and anxiety have been extreme, just because like as a mom, it's like, what am I supposed to do, you know? Had I not met you guys, he probably would have been more affected, because we would have been there when it was just like full of lead, because we're talking about numbers like in the thousands. So, and then moving forward with the eviction, I have been to court once in person, once virtually, and it's like, he's like, I'm just selling my home, she needs to get out. So it's like my story versus his story. So like at this point, how does he get away with that? Like, you know, like he's never like said I'm sorry, like nothing.
Him.
It's just a lot of sleepless nights, a lot of not eating. I've been trying to find a job, so I'm kind of like, you know, I'm taking like classes now for like early childhood education and stuff like that, because I'm really questioning myself now as a parent. Like, how long has the lead been in here? You know, how is everyone else sick? Is everyone else okay? Did I have lead poisoning? You know, so I feel like there's no safe place for women and children unless it's like domestic related. Like nobody thinks outside of that box, you know, because I've reached out to public housing, I've reached out to different places, and it's like, you know, everyone's just like, well, what do you mean? Like, you know, so they don't really have nothing set up. And I'm sure, like, it was even on the news, like, so I'm sure there's other mothers that are going through it and they just don't know what to do, or who to call, or what to, like, right now I just don't know my rights. Like, I don't know, you know, at one point I was like paranoid, like, is he able to just come put a note on the door and throw him, because he's posted things on my door, but then I'm like, is he able to just throw me out? Because it was like I would have 30 days, then 30 more days, and so now we're in the end of October and I'm still in this house. Not by choice, but it's the process. Get your crayon.
Have you found anybody else in the neighborhood who might be dealing with similar issues?
I went to talk to one girl. She had 3 girls. She had an apartment in McKeesport, and she moved into a house. She was financially able to move into, I think, a 4 or 5 bedroom house, and it just worked out for her. Like, she was able to just leave. She left everything there and she just moved on. I think she works at the hospital. So she was able to just like up and go. But I want to say her child had to get medicine because the lead was that high. What do you want to watch? Oh, they don't make lead paint anymore. Or was your kids eating paint? Or, you know, you need to watch your kids. Or, you know, you're exaggerating. The state has, like, they get paid if they say so many people are tested positive. I'm like, no, I'm not exaggerating. Like, this is real. Oh, no, we've lived up here for years. There's no lead in this. Or everybody would be sick. So there's a lot of, like, opinions where you're like, my children are sick. Like, this is not a joke. I have proof. I have blood work. I have, you know, documents. I have a big yellow folder just filled with reports and what tested positive. Once the health department did their inspection and they put him in like a bracket, so he had so much time to complete his work, or if he was to say, I'm working towards it, they would give him extensions until he completed it, which were like fair. That's awful. I'm not like a fancy smancy where I gotta have like a brand new house or newly renovated, but I mean, I had no idea what I was getting into moving in there. I had no idea. There's no way that house should have ever passed for anyone to move in there, Section 8 or not.
All right, so we watched that video. And so as we heard earlier from Sam, a lot of the houses throughout Pennsylvania were built before the 1970s, which was before the 1978 lead and paint law. So many houses are affected by lead and paint because they have not been updated, they have not been renovated. And then whenever people go in there unknowingly and do renovations, they are unintentionally spreading the lead dust everywhere. Sam, can we go to the next slide, please? So vulnerable population. So all humans may potentially be exposed to lead. However, there are certain groups that are more vulnerable than others to lead harmful effects. And those are children, young children under the age of 6, pregnant women, and then adults who are exposed to lead through their jobs, hobbies, or other cultural practices. Next slide, please. So lead is particularly dangerous to young children under the age of 6 because of their growing bodies, and they absorb more lead than adults, and their developing brains and nervous systems are more damaging or more sensitive to lead's damaging effects. Babies and young children's exposure to lead can be higher because they often put their hands and other objects into their mouth, which could be contaminated by lead from the dust or soil. Even if a pacifier is dropped on the floor or covered, it could be covered with lead dust. They could even eat paint chips because, like Sam did mention, they are sweet tasting, unfortunately. So children can also be exposed to lead by eating food or drinking water that contains that contains lead. And this includes drinking powdered formula made with lead contaminated water. So also another source of contamination could be eating lead dust that is settled on food and food preparation surfaces, eating game meats, like if you hunt or whatever, with lead particles from the soil, and eating food or drinking liquids stored or cooked in a lead crystal or lead glazed pottery in dishes. So foods and liquids stored in lead crystal or lead glazed pottery or porcelain can become contaminated because lead can leach from these containers into food or liquid. So especially a lot of pottery made from different countries, it doesn't have the same regulations as a lot of the dishes, pottery and things used over here. So it could very well contain lead in it. Also, consider toys. So toys and other products may contain lead, furniture as well, especially if it's very old furniture, possibly passed down. Antique doll furniture or antique toy jewelry could contain lead-based paint or lead in other parts of the material. So this is a problem if a kid bites the jewelry or the toys. So it's just always important to make sure parents that you work with are up to date on product and toy recalls due to lead contamination and other contaminations. Sam, next slide, please. Health effects of children. So like we said, there is no safe level of exposure to lead. So even small amounts of lead in the blood of a child can result in, like we said, behavior and learning problems, lower IQ and hyperactivity, slowed growth, hearing problems, and anemia. And in rare cases, high amounts of lead can have devastating effects on children, including seizures, coma, and in some cases, even death. Next slide, please. So while lead poisoning is while lead exposure is most common in children from the ages of 1 and 2 years old, some pregnant women may also be exposed to lead from the intentional ingestion or mouthing of soil, clay, or pottery, which is a behavior known as pica or pica. Some people may also partake in the deliberate consumption of earths, clay, soil, and rocks as a part of their cultural practices. So this is an issue if the soil or the clay or the pottery has lead in it. And this can lead to serious health effects to both mother and her developing fetus if the source of the clay, soil, or rock does in fact contain lead. Next slide, please. So lead can accumulate in bodies over time. So it's stored in the bones along with the calcium. So during pregnancy, lead is released from the mother's bones along with the calcium and can pass from the mother, exposing the fetus. Or it could be the infant can get exposure from breastfeeding. So this chances of this exposure increases if the mother does not receive adequate calcium in her diet. And so this can result in serious effects to the developing fetus and infant later. So it could cause the baby to be born too early or too small. As we know, it could hurt the baby's brain, kidneys, and nervous systems. Increase the likelihood of learning or behavioral problems, and it could also put the mother at risk for miscarriage. Next slide, please. So what are some things you can do to take action? So lead exposure and lead poisoning is preventable. In fact, many cities and states throughout the country have implemented their own programs and projects over the years to lower their exposure to lead and its harmful effects. And we will continue to discuss some of these actions that you can take to reduce children's potential exposures to lead. Next slide, please. So, number 1, you can keep your learning center, whether it's an early learning center or a school, clean and dust free. So you should inspect and maintain all painted surfaces for chipping paint or dust. So that means bare floors, carpeted floors, windows, window sills, doors, door frames, railings, walls, ceilings, and the trims, banisters, and also porches as well. You should wipe down these hard surfaces like countertops or the window sills with a wet cloth, like a microfiber cloth, a wet microfiber cloth, so that the lead dust isn't going in the air, that you're actually getting it up. And you could use a HEPA vacuum as well. So also, number 2, wash your hands. You should use soap and water to wash children's hands several times a day, especially after playing outside. Adults, definitely wash your hands especially if your hands may have come in contact with a surface that could contain lead. So you should play in the grass. So guide children to play in grassy areas, not bare soil. Don't let them play in the dirt or the mud, especially if the play areas are near roadways, junkyards, older buildings, and or abandoned properties, abandoned sites, things like that. Whenever kids come in, make sure they wipe their feet, preferably with a rubber mat on the floor, dust mat. You should have those at all entrances. Also pets too. If you have pets at your homes, wipe off their pets before you bring them indoors. So number 4, wash toys, pacifiers and bottles. Make sure these are washed often. Do not let children chew on painted toys or especially windowsills or any other painted surfaces. Next slide, please. Another take action tip is to filter water systems. So whenever you're using water for drinking, cooking, or making baby formula, use cold water, but also make sure that your water is filtered. You use a filter on the faucet, or use a filtered water pitcher, or you could, get a reverse osmosis. But the most cost-effective things to do are filters on the faucet or filter water pitchers. And make sure the filters are, like it says here in the presentation, IAPMO certified to reduce lead, forever chemicals, chromium, and mercury. Next slide, please. So, looks like we're going to get to wrap up early. So, in conclusion, we discussed sources of lead exposure, how lead harms children and adults, its impacts on environment and wildlife, and actions that you can take to prevent potential exposures to lead. So eventually we do have 2 more lead modules that will go into more detail about how you can effectively clean your facilities to reduce exposure, also good hygiene practices, also nutritional information, and how and when to hire a certified lead professional to remove lead. Next slide, please. So here are some resources. And one thing I just want to highlight is the only way to know if a child has lead in their blood is to have a blood test, because lead exposure often occurs with no obvious symptoms. It frequently goes unrecognized, so no amount of lead is safe for children, and it is generally recommended that children be tested at the ages of 1 and 2. In Allegheny County, it is required for children to be tested at 9 and 12 months, and again at 24 months. So if you need more information about blood level testing, definitely reach out to your healthcare provider, local health department, or a clinic or hospital. So this slide has a lot of resources for environmental lead testing and lead hazard remediation for homes and learning facilities in different regions of the Commonwealth. So just want you to know that this presentation will be shared with you after today's webinar, so you will have access to these links. And also the high blood levels is a reason for early intervention. It's a priority for early intervention. So if anyone a child tests positive, then they could get referred, and there is information on here about that as well. Next slide, please. So here's information about our EcoHealthy endorsement. So Women for a Healthy Environment, we can we help work with Children's Environmental Health Network, and we go through a checklist of 35 different items to help childcare centers become more environmentally friendly places for children to learn in. And some of those things are regarding lead. So we can provide things like water pitchers, and other resources such as the walk-off mats to wipe their feet and microfiber cloths as well. So if you are interested in signing up for EcoHealthy childcare endorsement or even just getting information on it, please scan this QR code or email Paige. Her contact information is down there, and we could set you up with those resources. Next slide, please. I guess one thing I want to mention, EcoHealthy endorsement, we could do that throughout the state of Pennsylvania. So anyone who wants to sign up for that will do that. We have also our 1,000 hours a year program. So this is, unfortunately, right now it's only for Allegheny County, but with that, for early learning centers and school districts, we can offer lead testing and remediation if needed. So we can help you filter your water systems that need it, whether it's in the kitchen, your water lines, or if you have water fountains, if they need replaced, things like that. We also do radon testing and mitigation as well. So you can scan that QR code and email Sam for more information about our 1,000 hours a year program. At this point in the presentation, I would like to ask, does anybody have any questions about the materials that were shared today? Okay, next slide, please. So if you all could take this lead awareness module 1 post test. Let me find the link for you all. How can we get PQOS credit? Paige, could you answer that while I look for this link, please?
Of course. So when it comes to PQOS credit, we will be sending out a survey afterwards where you would include your PD registry ID number. But even just attending the webinar, I have your information where I would be able to award you everyone will be getting 2 hours of PQOS credit for this session. So you're probably only going to see the PQOS credit a few weeks after this session. But I hope that was a long answer to your question, but you will be getting it, yes.
Okay, I'll give you all one more minute to do that. So I want to make sure I have the link for the next one as well for you all. See them coming in. Thank you. Okay, so I think we have, let me see, 2 people. I know that's wrong. We have about 10, so that's good. So Sam, let me make sure I'm back here. If we could go to the next slide, please. So I want to just thank you all for joining us today, and we really hope that this webinar has inspired you to take steps towards creating a healthier, safer learning environment for your students. So for more information, please don't hesitate to reach out, and together we definitely can create a healthier future for our children. I have Paige's contact information for any healthy early learning stuff on here, Sam's contact information for healthy schools, and you could always reach out to me as well. And here is the survey. Please take this survey as well, and let me copy the link for you. And this survey is so if anyone who registered for this event and takes the survey will be entered into a raffle to win a HEPA vacuum. And there's that survey. And also on there, like Paige says, you will have the opportunity to put in your registry ID number. Thanks, Paige. You're welcome. So do we have any last questions while everyone takes that last survey? No questions. Yours keeps spinning. Huh.
We can also share the survey out.
Yeah, it's definitely
if you
going to be
don't-
shared out afterwards.
If you don't know your registry ID number off the top of your head, which no one does, don't worry about it. I will be sending out the survey and any information to attendees tomorrow. So you'll have time to be able to find it. But I can also
Yes.
find it with your email address. So
Yes, don't worry. You could put NA or something, and then yes, Paige will follow up. So I'll let you all go with an extra hour, but don't worry, you will still get all of your credits. So don't worry about that, everybody. I hope you all have a very nice evening.